this is the Respironics V60. This is commonly used in the hospitals to give patients BiPAP therapy, which is a non-invasive ventilation. So it has an electrical source that you plug in, and then you plug in the oxygen tubing. So you're going to come to this menu. It's currently in standby mode right now. But real quick about the V60, like I said, it's non-invasive. It's typically used for patients with like COPD, who are like, pre-respiratory failure, but still able to spontaneously breathe on their own. So this is the tubing with the mask interface. And then I'm going to demonstrate putting this on the patient. So while in standby mode, like we're in now, if I put this back on the patient, it should automatically take it out of standby and resume its previous function, I guess. So, okay. So the mask interface, typically I undo the two bottom ones.
The clips, not the Velcro.
Oh, I don't need to do that.
Yeah, undo the clips,
okay,
because your Velcro is set to the patient's fit. Yeah. So if you undo the clips instead of the Velcro, then you'll have a good fit.
This one doesn't have a clip.
Okay, that's fine. Okay.
You're just going to kind of slide it behind their head to fit it. You bring it over the top. This side doesn't have a clip, but typically you'd have a clip on that side. Alright, so you're just going to bring this around. Clip it there. And then you just want to adjust. You want it pretty tight, but not, and then you're going to check your air leak.
Okay.
So
I want to, will you undo the Velcro on the top to slide it down a little bit more? Yep. So grab both sides and undo the, Yep. And just loosen it just a little bit. So if you have a situation where you want to lower the Velcro at the top, you can undo both sides and at the same time tighten them at the top. What do you want to make sure when you are placing the mask on the patient? No leak. What do you look at on the BiPAP machine to make sure that you have a good fit?
So this patient leak here.
Okay.
So 79, that's pretty high. We usually want under 30. Right?
Okay. So can you adjust it to get the leak?
Yep. So typically it means it's too loose, so we'll probably adjust.
And on the mask, you always want to make sure you have a good cuff suction. So around the edges of the plastic of the face. Yeah, you want to make sure there's always a good cushion so we don't cause skin breakdown around the nasal area and the bridge of the nose. Yeah.
Ready, 2, 3.
Yep, there you go. You always, in order for you to be able to do that, you're going to loosen up the Velcro on the side, let air go underneath the mask, and cause a suction kind of cupping to the face so we don't flatten out the plastic that's around the face.
So now we have a leak of 3, well, fluctuating, but it's low, so
okay,
that's
good, excellent.
Acceptable, yeah.
All right, so how do you reset the alarm?
Reset the alarm?
That's the setting, so go up to the very top and hit alarm reset.
Oh, alarm reset.
There you go. All right.
Okay, so alarm reset, alarm silence is here in the top left corner.
Yep.
And if you ever want to do standby and the patient's on the mask, you want to make sure you take them off the mask first and then do standby.
Okay. Can you show us how to do that?
Yep. So I'm going to take the patient off of the mask. Alright, so now the patient's off their mask. Now we can go down here to the bottom right, standby. So remove mask or disconnect. So now we're disconnected and now we're on standby. So.
Okay. Can you explain what the ST mode is?
So that's spontaneous trigger mode.
Uh-huh.
So that means the patient has to, the mask or the device has to register a breath from the patient in order to trigger the machine to work, basically.
Okay. All right. And then does the patient control the tidal volume?
Yes.
Does it control their own rate?
Yes.
And when does the backup rate kick in?
It doesn't. There's no backup rate. So if the patient stops breathing, then you need to contact the respiratory therapist because it's not going to kick in.
Here's the backup rate.
Oh, there is. Okay, yeah. So we have a backup rate of 8 on this.
So if they stop breathing,
so we'll kick in
a backup rate.
Yes.
So that rate that's on the machine is only active if the patient stops breathing.
Okay.
Okay. All right. What is IPAP?
So that's inspiratory positive airway pressure. So BiPAP's bilevel. So yeah.
Oh yeah. Okay. All right. So when would we go from non-invasive BiPAP to determining if the patient needs to be intubated?
So their clinical condition. So their like any lung history they have. So if they have COPD. And you tried BiPAP first on the V60, but if their ABGs are not improving or they just don't look good or look worse, so you go off ABGs, your pH, your CO2, and then their clinical condition, how they look, and then if they deteriorate really bad, then you want to consider doing invasive.
What about when they stop breathing on the BiPAP?
When they stop breathing, that's an indication to get do invasive.
Okay, good. What about if they're unconscious on the BiPAP?
That's another indication because they're not breathing on their own.
Okay, all right. They're not able, and when they're unconscious, they still can breathe on their own, but they can't protect their airway.
Yeah.
And especially if their volumes, they could be breathing but not adequately breathing a high enough tidal volume to support them off of to support themselves on a non-invasive ventilation. So that is another consideration to initiate a patient and request for them to be intubated. Can you tell us what blood gas, like what the pH and CO2 would be that would identify a patient in respiratory failure and the need for invasive ventilation?
So what you're looking for on the ABG is at their pH and PCO2. So anything under a pH of 7.25 and anything greater than a CO2 of 55 would typically warrant the need for the invasive.
Okay. All right. So